Morning guys. Well, this morning I started to do another video about my stay away and some of the stuff that I filmed, but I had all this lined up to do a video about blood and blood type specifically, and blood type and diet. Now all through my life, especially over the last 20 to 30 years, I'd say, I have days when I'm so exhausted. Sometimes it runs into 2 days, or I can't even get out of bed. It's the most awful feeling. And a few years ago it got so bad that I became convinced that I had chronic fatigue syndrome, or MS or something like that, or was very, very sort of like low on iron or bit D or something. So I went to the doctors, had all these tests, and they said, no, your iron, a little bit low, but nothing to worry about. Thyroid's okay, no diabetic problem, you're okay, go home, you're all right. And I thought, oh, well, you know. Oh, God. And I remember a few times when I've had this exhausted thing. I can't begin to describe what it's like. It's the strangest feeling. But a few times it's like I've looked at what I've eaten and thought, well, I haven't really had anything to eat. Maybe I'm allergic to wheat. Maybe I've got a gluten problem or a milk problem. But I never investigated it. They never suggested I might be allergic to any food. And so I just went on my way. Anyway, after I had this last blood test, about 2 weeks later, the doctor phoned and said, can you come in? We'd like to give you a blood test. And I went in and I said, well, what's this? He said, oh, it's your immunoglobulins. We just want to keep an eye on them to make sure, you know, that it's all okay. And I said, well, what do you mean, my immunoglobulins? And he said, oh, well, you know, we just need to keep our eye on them. I'm sure everything's all right. So anyway, back then, you know, I wasn't questioning quite as much. I was questioning, but not quite as much as I am now. So I had my blood test. Went home, didn't think much about it, and then went back again 6 months later, and this time I said, can you explain a little bit more about what might go wrong? And this doctor was a very young, gung-ho sort of guy, and he said, well, your immunoglobulins, you know, if they should like go a bit sort of wonky or anything, you could be at risk of cancer, but you know, we got things that can help you with that. I said, cancer? And he said, yes, it could be blood cancer, blah 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 blah. So I went away, and this time I did some research. Now, I'd already looked into my blood type a few years ago when everybody was looking into Rh neg and all that, and I know I'm B pos because it was written on my appointment card when I was pregnant with my daughter, who's now 44. I remember seeing it. And I'd found this about diet and blood type, which rang a bell back then, but I went back to it. And this guy says here it's not just about transfusion. Our blood actually is affected by what we eat, and what we have in our blood is responsible for breaking down our foods. So food fads come and go, but the facts are clear. Everyone does not have the same basic nutritional needs. We all know someone who was a strict vegetarian and thrives on that diet, while others swear by Atkins or similar low-carb plans. But I found that your nutritional needs can be determined by your blood type. So your blood type affects more than just the type of blood you need in the event of a transfusion. So your blood type antigens aren't just in your blood. They're everywhere, particularly in the surfaces that interact with the environment. These include your digestive tract, from your mouth to your large intestine, as well as your nasal passages and lungs. Because these blood type antigens are everywhere, they influence how your body reacts to the food you eat through several factors. For example, the lectins in certain foods bind to your blood type antigen and cause your blood to agglutinate, stick together, resulting in feelings of fatigue, headaches, digestive issues, skin problems, and a host of other health issues. So if you go here. Type O people, they fare best on intense physical exercise and animal proteins and less well on dairy. The leading reason for gait weight among type O's is the gluten found in wheat products and to a lesser extent lentils, corn, kidney beans and cabbage. Type A. Those with type A are naturally suited to a vegetarian diet and foods that are fresh, pure and organic. As type A's are predisposed to heart disease, cancer and diabetes, I can't emphasise how critical this dietary adjustment can be to the sensitive immune system of type A. B, this is me, we have a robust immune system and a tolerant digestive system and tend to resist many of the severe chronic degenerative illnesses, or at least survive them better. Type Bs do better with moderate physical exercise, and he's got a whole section on the exercise we should do. Type AB is a very complicated one, and they sort of do better with like a combination. So blood type with its digestive and immune specificity is a window on a person's probable susceptibility to or power over disease. Type Bs are also especially susceptible to autoimmune disorders such as chronic fatigue, lupus and multiple sclerosis. Right, that's me. So I had a look at what they consider to be a balanced diet. So look at a balanced diet and you'll see this is like your general sort of thing. A bit of everything, a balanced diet, isn't it? They sort of give you a plate. Like, this is a good one. Carbohydrates, everything in there. Corn, millet, rye, all the different seeds you can eat. All this veg you can eat. Treats, lots of sugar, and then your sort of dairy stuff, yeah? And they all pretty much give the same thing. Balanced diet. Bit of everything, you know. Here we go, balanced diet. One size fits all. Here's my blood B. Now it says that blood B, I have a genetic potential for great malleability. For type Bs, the biggest factors in weight gain are corn, wheat, buckwheat, lentils, tomatoes, peanuts and sesame seeds. Each of these foods affect the efficiency of your metabolic process, resulting in fatigue, fluid retention and hypoglycemia, severe drop in blood sugar after eating a meal. I get these, or I got these. When you eliminate these foods and begin eating a diet that is right for your type, your blood sugar levels should remain normal after meals. Another very common food that type B should avoid is chicken. Chicken contains a blood type B agglutinating lectin in its muscle tissue. Although chicken is a lean meat, the issue is the power of an agglutinating lectin attacking your bloodstream and the potential for it to lead to strokes and immune disorders. Dr Adamo suggests you wean yourself away from chicken and replace them with highly beneficial foods such as goat, lamb, mutton, rabbit and venison. Other foods that encourage weight loss are green veg, eggs, beneficial meats and low-fat dairy. Now, I've been veggie for 4 years now, so I haven't eaten any chicken. And I've been thinking about my diet growing up, as we were very sort of like poor when I was a child, and we lived on things like chips, mashed potato, stews. When we were broke, it was like sugar butties, that's bread and butter with sugar on, bread and butter with bananas on, jam on toast. We were really like, you know, not very well off. And then when I got to my teens, like early teens, chicken was something that you had at the weekend occasionally. It wasn't like as it is now, KFC shops everywhere and, you know, trays of chicken all over the place. Even mushrooms were like something that rich people had, or you had on a Sunday breakfast when your grandparents came to stay. It wasn't like it is now. And then as I was sort of like growing up and older, I never had a lot of money. I'd never really liked beef burgers and things, so I haven't had a lot of meat eating going on, and now none at all. But the one that he really got me with was seafood, because he says I shouldn't eat seafoods, and I live by the sea, and I had a lot of friends who were fishermen, and now and then they'd sort of like bring crabs in and give me a crabbles, and I'd do it and I'd eat it and it'd be nice, but I'd be ill, really ill afterwards. And there's a part here that says I shouldn't be eating seafoods, and I can't find it now. So apparently my blood type developed in the area of the Himalayan highlands, now part of present-day Pakistan and India. If you look at blood types by country, blood type B, B+, which is moi, is higher in areas like Bahrain, Bangladesh, and the Indian and India. So type B is found in increased numbers from Japan, Mongolia, China and India up to the Ural Mountains. The small numbers of type B in Western Europeans represents Western migration by Asian nomadic peoples. I don't agree with everything he says, because when he looks at the genetic thing, he does say that, he goes into evolution, but movement of populations I definitely agree with. So I just thought to myself, well, what if what I'm eating is part of this immunoglobulin problem that I have? This was good. Personality. So type Bs often describe themselves in ways related to the following characteristics. We score higher on intuiting, indicating a preference or sixth sense info. We tend to be insightful, mystical, idealistic, creative, globally, plane-oriented, people-oriented, and good at imagining. They also reported that they learn best through listening, then reflecting on, interpreting what they had observed. My God, that's just me. Oh, and we tend to be slightly taller than usual, and I'm the tallest woman in my family. I'm 5'8". My sisters are and my mum are 5'1". I'm like a giant in the house. So I went back to my doctor, the new doctor that I had, because my old gung-ho one, and I explained to him that I wasn't going to come for the blood test anymore, because even if he did diagnose me with this spectre of cancer, I wasn't going to have the medication anyway. I wouldn't go down that path. And then I posited to him the idea that maybe my diet might be able to help me. Oh yeah, briefly, the other doctor, my first doctor, after he sort of issued me this sort of like news about, I may have potential cancer in the future, I asked him back then, I said, is there anything I can do to help myself? And he went, no, nothing, unfortunately. And that was when I went away and started to have a little look for myself. So what does Dr. Peter say about immunity? Endotoxins, allergens, and the alternate complement cascade. So he looks into immunoglobulins here. The role of IgA is closely related to the potential for gut-related health problems. So, immunoglobulins are glycoprotein molecules produced by plasma cells. They act as a critical part of the immune response by specifically recognizing and binding to particular antigens such as bacteria or virus. So, right, okay. And here's my test. They are called IgG, IgM and IgA. If they're too low or too high, it could be a sign of an autoimmune disorder. The role of IgA is closely related to the potential for gut-related health problems. IgA is most commonly used by the body to soak up allergic substances from the digestive tract. It is usually evenly distributed throughout the gut tissue, except in specialized lymphoid areas where large amounts are manufactured and encapsulated. So it's quite insufficient IgA production is a common immunodeficiency in 1 in 600 individuals of European origin and can result from dietary imbalance, tonsillectomy, I've had one of them, or appendectomy. If there is insufficient IgA in the tissues to bind with microbes or allergic particles, they will pass into the portal circulation and liver. If the liver is incapable of dealing with the immune complexes coming from intestinal absorption, they will pass into the systemic circulation and stimulate a general immune response. Allergic disorders and autoimmunity occur with undue frequency in the milder forms of IgA deficiency. It's quite scary, really. The digestive tract can be thought of as being semi-permeable. The gut is both absorptive and secretory. So, right, my new doctor. So I speak to my new doctor and I tell him I don't want this blood test, and he's shocked. He shouted at me. He said, you do realise that you could get really ill and you could die of cancer? And I said, well, we all have to die one day, and to be honest, I really don't think this is going to happen to me, because I'm going to keep an eye on myself now, and I believe that my diet is affecting how I am and my health. And he poo-pooed it. He said, I've never heard of this. I said, well, it's I said, I know a lot of people discredit the internet. I said, but there's a lot of information about blood group and diet, and also I had a little bit of something to back me up, because I also know my mum and dad's profiles, and my mum is AB negative. My mum gets a lot of chest infections. My mum has a heart problem. She gets anemia, and it actually says this in here. They should avoid caffeine and alcohol, smaller meals, empathetic. I'm trying to find where it says this about the sorts of things that can happen, how ill they can get. Because it is my mum. Type AB blood is rare, found in less than 5% of the population. But it does say that she tends to, they lack enough stomach acid to metabolise certain meats, and they're prone to mucus infections, which my mum gets. So I reeled out this stuff about my mum, and then I reeled stuff out about my dad, and he said, no, I'm sorry, eating isn't going to have any effect at all. Changing your diet isn't going to have any effect at all. But I've been thinking a lot about this. I mean, one size suits all is the most economic thing to do for people, isn't it? I mean, if we were really aware of our blood types and reaching for our blood types, so many of these corporations wouldn't be making any money, would they? McDonald's, KFC, all of these fast food joints would be much more careful about buying this horrible plastic bread. I don't think we should be eating corn and wheat the way we do. And I must say that I have been following his diet a hell of a lot better. I've been eating rice cakes. All of our preferences for food are based around taste. And I did some research on this, and I found a couple of videos discrediting this. But in the comments, there were lots and lots of people who it was working for. And the few videos that I found that were really discrediting it, one of the guys had like a NASA t-shirt on, so I don't know. And apparently he's now sort of like going into genomes, like different blood groups have different sort of like other sort of like splits off, so it isn't one size fits all even with the blood group diet, because you might find that some things affect you. But he's got a lot of stuff here: blood groups in the intestines, minor blood groups, metabolic consequences. Oh, and talks about secretors and non-secretors. He's really gone into this. Really gone into it. I was talking to my daughter about it, and she went, "Oh yeah, but back then there was all these fad diets, weren't there? All these fad diets coming out." I said, "Well, yeah, there were, and maybe he got sort of like lumped together with all of these other fad diets that were out, sort of like 80s, 90s, and what have you." But I mean, my doctor said to me, he said, "I've got 4,000 people in this practice, or some thousand, some." He says, "And there's 4 of them with this blood condition you have, and you're the only one complaining." I said, "Well, I'm not complaining. I'm just telling you that even if I was to come here and you showed me a mournful face and, you know, gave me some sort of like ghastly diagnosis, I would not have your treatment." Back in 1989, when I was 34 years old, I had a smear test and I was diagnosed with cervical cancer, and they wanted to remove my womb, and I wouldn't let them. I said no. And a year later they said I had the all clear, and I went on to have 2 more children. I don't have a lot of faith in the National Health Service. I don't have a lot of faith in our government. I don't think they have our best interests at heart. I think they treat symptoms, and I don't think they treat causes. I think a lot of us are eating foods that aren't suited. We feel ill after them. I think that fatigue that I was feeling back in the day when I'd stay in bed and I'd be looking at my diet thinking, well, I only had a cheese and tomato sandwich, but I had a cheese and tomato sandwich on wheat bread, and tomatoes I have a job digesting, and my metabolism was being knocked for 6 because I was trying to digest foods that I just don't have the enzymes to digest. So this isn't actually meant to be hang on, let's just show you what my diet is. It's really nice. I mean, all I was bothered about was that I'd get olives and avocados and stuff like that. So the blood type diet. Type O, O's are quick to anger and can eat pretty much anything. They're the sort of ones that can eat lots of meat, lots of red meat. A's, I've got to sort of like keep it a little bit more sort of down. B, red meat, broccoli, my favourite veg, my favourite food. Cultured dairy products, onions, pineapple. Avoid chicken, corn, peanuts, lentils and buckwheat. I mean, that's hardly difficult, is it? That's not difficult. And AB, my mum's, walnuts, cauliflower, cultured dairy products, tofu, food to avoid, chicken, corn, buckwheat, because I must have inherited my type B from my mum's AB. Yeah? So she's got a similar sort of like setup. But yeah, look, nice foods, good foods. I won't be introducing meat into my diet because I have gone vegetarian and I don't intend to go back. In fact, I'm probably going to go more vegan way than meat way for sure. But I was out with my sister and we were talking about our childhoods, and when we got to the top of the cliff after we'd had this long walk, I said to her, I said, wow, I said, it's really weird. I said, I don't feel as exhausted now as I did when we were kids walking up here. I said, but I was a very overweight child, wasn't I, Jill? Now, I got 6 brothers and sisters, and I was really overweight. I was the overweight one. And my sister turned around to me and she said, yeah, she said, how did you get so overweight? She said, we never ate anything. And I said to her, oh, I don't know. I said, maybe it was all those sandwiches we ate, all those, you know. And looking at it since, maybe I was eating foods back then that my body just wasn't metabolising properly. Breads and cereals and just cheap foods that aren't sort of suited to my blood type. And I also said to my doctor, I said, why can't I get my blood group? And he said, oh, you can if you become a blood donor. And I said, well, I don't want to be a blood donor. I've got no intentions of becoming a blood donor. He said, well, there's no real reason for you to know your blood group, is there? And I said, well, what if I had a really rare blood group and I got knocked over, or there was an accident? Maybe I had my hand cut off in a terrible accident and they needed my blood group quick. I said, I just feel that it's something that people need to know. It's part of us. It's part of our makeup. We need to know. And as Dr Adamo says here, at the beginning of his little spiel, oh God, I hope this isn't a sign of my voice going slow. Do you think knowing your blood type is only important in the event of a transfusion? Think again. Research indicates that your blood type is a key genetic factor that influences many areas of health and well-being. Throughout your life, you probably observed that some people lose weight easily, others don't, and some are ill and others stay well. Is it our food? Is it they're pushing this because economically it's better to get everybody eating everything, isn't it? So a healthy diet gives you all the nutrition, adequate calories. I'm going to give up with that. So anyway, just tell me what you think. Am I on the wrong track here? Am I on the right track? I just feel that to have people sort of taking more notice about the foods that they put into their body. I saw a video by one of our lot. I can't remember who it was. It was John Levi, Conspiracies or us, one of our bunch, who said that food is our medicine. Food is our medicine. What we put in our bodies dictates how we feel, and it's our health. I think that if I was to continue eating chicken, corn and tomatoes, I may well trigger this IgA immunoglobulin problem. But if I keep away from these things and give my body a chance, maybe I'll avoid that fatigue I used to get. And that's another thing. My granddad used to come to see us when we were children, and he'd never eat tomatoes. I'd say, you want tomato, Papa? And he'd say, oh, I can't eat tomatoes. I like them, but they don't like me. And I always thought it was really strange, because I've always thought of tomatoes being a very fairly sort of innocuous sort of thing, you know, lots of vitamin C, and as of lately, tasteless balls of water. So yeah, who wouldn't think? But a tomato is a particularly sort of fleshy thing, and maybe there are enzymes in there that some of us just can't deal with. So yeah, that's it. That's pretty much it. That's pretty much all I've got to say about this. So I have got a potentially sort of like cancer giving blood problem around my immunoglobulins that I believe I can help avoid by changing my diet. Tell me what you think, and thanks for watching.